My warm greetings to all attendees of the RAADfest 2021. Dr. Dmytro Klokol here with you. It is an absolute pleasure to be a speaker at the RAADfest for the fourth year in a row. Although we may be separated geographically and travel has become a challenge and a bit complicated due to pandemic, but thanks to a coalition of radical life extension, we are brought back together again in this wonderful opportunity to share and exchange the knowledge and experience about the most important matters, which are the health span, longevity, and lifespan. Speaking of which, 2020 was a challenging year for the entire world when all of us have witnessed the importance of health, physical fitness, and overall the resilience of the organism. Its readiness to fight the pathogen, in this case, the virus that affected the lifespan. In other words, the ability to survive the infection, to transit through the initial stage of the disease, produce an adequate innate immunity response, develop adaptive immunity, and recover and obtain the lasting immunological memory, preferably without long-term complications and damage to the internal organs. And that's what I and my team in the European Wellness Group were focused on since the very beginning of the pandemic. We continue our search for the most effective therapeutic strategies to increase lifespan and health span, to reverse chronic age-related diseases and improve quality of life. Please allow me to briefly introduce myself to those who perhaps don't know me. I'm a medical doctor with a specialization in surgery, and my second specialization is in regenerative medicine. I have a PhD in surgery as well. I did my PhD in reconstructive surgery. And for the past number of years, I'm mostly involved in regenerative medicine and stem cell research. Well, my personal passion is in longevity medicine, anti-aging, disease prevention, and reversal. I'm head of the medical advisory in the European Wellness Group. And recently, I was also appointed as a medical director for the regenerative medicine division of the European Society of Preventive, Regenerative, and Anti-Aging Medicine. I have a standard disclaimer here for you, ladies and gentlemen. And without further ado, while governments, healthcare authorities, and various institutions are quite rightfully concerned about the herd immunity, control over the spread of the virus in the communities and across the borders. In other words, the collective protection. Our focus was predominantly on the personal protection and ways to improve it. It is beyond the shadow of the doubt that majority of the COVID cases are either asymptomatic or recover without hospitalization or any specific treatment at all. But in the same time, this virus turns out to be one of the most deadly pandemics in the history of the human civilization. Let me ask you a question. Why? Because the main victims of this virus are senior individuals and people with underlying chronic lung disease, heart disease, diabetes, obesity, cancer, and impaired immune system. The same old chronic degenerative age-related diseases. It's just same old, same old. The conditions broadly related to aging, accelerated aging, and pathological aging. Why I say so? Because though aging is an inevitable biological process, and it is actually okay to age, but while aging, we don't have to deteriorate, become old and sick. There are effective ways and biological mechanisms to avoid frailty, to preserve, restore, and even improve the conditions and functionality of tissues, systems of organs, and entire organism practically at any age. We have multiple clinical examples of that when a person recovers from metabolic syndrome, obesity, reverses diabetes, atherosclerosis, chronic heart or liver disease, and even reverses biological age. And by the way, I am one of such walking examples. And now we have sufficient evidence proving that anti-aging and longevity medicine protocols are essentially effective at any age. These protocols can be initiated at any age, and there will be benefits and improvements to a various degree depending on the case, even if these interventions are started at the stage of the clinically fully pronounced disease. So as we all can see, at the very core of the problem, we find senescence, including cellular senescence, chronic low-grade inflammation, impaired adaptation properties, and impaired regenerative mechanisms inside the cells and tissues. The same pathological mechanisms that lead towards aging and age-related diseases that, by the way, Coalition of Radical Life Extension and RAADfest were highlighting and trying to solve for all these years, the same mechanisms are involved in morbidity and mortality from COVID. The drivers of pathological aging and risk factors for morbidity and mortality from COVID are fundamentally the same. As you probably remember, and I was talking about it on many occasions, including previous RAADfest, People Unlimited, A4M, and other medical conferences, we have been working on a programmatic approach to health management. A few years ago, we have developed the DDRR protocol, the Diagnose, Detox, Repair, Rejuvenate protocol, which I've described in details in one of the books that we have published titled Comprehensive Guidance to Biological Medicine and Wellness. During the last year, I was able to refine those protocols and algorithms that I was developing for years. And the result of that, we have these 3 pillars of wellness, the 3 principal directions of therapeutic interventions: support of the immune system, reversal of the metabolic syndrome, and third one, hormonal optimization. So I'm going to go through each of these directions and present to you the actual protocols and treatment modalities that we use. And let me start with the immune system support. In spite of this topic being seemingly given much attention, and we can literally hear calls to boost immunity and improve immunity, it's like at every corner. The reality of situation is such that there's practically nothing done about it. One of the most evident examples of that is vitamin D3 deficiency. Global survey shows that at least 1 billion of people are vitamin deficient, while 50% of the world's population have vitamin D insufficiency. In USA, the vitamin D deficiency ranges from 32 to 50, 60% among senior citizens. In equatorial countries in Southeast Asia, in spite of a long duration of daytime, which is supposed to provide adequate exposure to sunlight and facilitate endogenous synthesis of vitamin D, it's actually even worse. It's around 78% of adult population are vitamin D deficient. The importance of the vitamin D3 to immune system is perfectly illustrated by the fact that 98% of severe cases of COVID-19 that require ICU admission and management are vitamin D deficient. Why is it so? Well, first of all, vitamin D is a steroid hormone that acts through the nuclear vitamin D receptor as a transcription factor that regulates hundreds of genes responsible for essential physiological mechanisms. Such receptors are also widely present on the T cells responsible for adaptive cellular immunity, on the B cells, which are responsible for production of antibodies, and on the antigen-presenting cells, which are crucial for development of immune response to antigens, such as viruses, bacteria, and cancer cells. Vitamin D is also a regulator of both innate and adaptive immunity, and its deficiency is associated with autoimmunity and increased susceptibility to infections. In the practice of European Wellness Group, we use the product called ImmuneVit, which contains the cholecalciferol 5000 IU combined with a high dose of menaquinone, which is a K2, to provide a higher efficiency of the product and activation of the osteocalcin protein. Same time, it's very important to administer magnesium because all enzymes that participate in metabolism of vitamin D require magnesium as a catalyst for those biochemical reactions. By fighting the vitamin D deficiency, we can increase the number of T regulatory immune cells. And in the same time, it is also increasing the clinical efficacy of the GCMF, the macrophage activating factor. This protein is crucial for activation of macrophages, cells which belong to the innate immunity and act as antigen-presenting cells, which means that it facilitates the successful transition from innate immunity to adaptive immunity. The next aspect of immune support is thymic regeneration and reconstitution of thymus. As we know, thymus is a primary lymphoid organ where the maturation of T lymphocytes is taking place. Thymic involution and loss of thymic function occurring with age results in a phenomena called immunosenescence, the clinical manifestations of which are increased susceptibility to infections, increased autoimmunity, increased cancer occurrence, and impaired response to vaccination. So how to regenerate thymus? The effective protocols for the thymic regeneration include stem cell therapy with the thymic precursor cells, thymic peptides, which are the naturally occurring molecules that promote regeneration and reconstitution of thymic epithelial space. It's the anatomical area where the maturation of young immune T cells is happening, and also recombinant human growth hormone. This is a bulletproof protocol for regeneration of thymus, both anatomical and functional. And by the way, these are grossly underrated therapeutic modalities, which are very highly efficient and relatively inexpensive, definitely requiring more attention. But because of lack of interest to the pharmaceutical industry, these modalities are left pretty much unknown to the public. The second pillar is metabolic optimization. And when it's coming to optimization of metabolism, I mean the reversal of the metabolic syndrome. And the strategy that we apply to achieve that can be best defined as biohacking. In a nutshell, biohacking means interference with the genetics, and through that, the optimization of metabolic functions of the organism. In practice, it starts with dietary modifications. It's either caloric deficit or intermittent energy restriction, elimination of processed food, refined sugars, and fructose. Yeah. So it's not only the strict caloric count and count of the macronutrients that helps here, but also triggering the autophagy and activation of the longevity genes through the intermittent fasting. Next thing, physical activity regime. We're talking about cardio between 150 to 300 minutes per week of moderate intensity cardio plus resistance training. It provides strengthening of the heart muscle, increases release of the growth hormone, and prevents development of sarcopenia and frailty. In other words, preserves skeletal muscle mass. Next point of biohacking is optimization of rest and recovery. That includes yoga, stretching, tai chi, qigong, meditation, but also such modalities as systemic hypothermia, which is also beneficial via production of the heat shock proteins, hyperbaric oxygenation, theta chamber therapy, and transcranial stimulation. And finally, once diet, physical activity, and rest is settled and put on the right track, the supplements and medications can be used. When it's coming to supplements and medications, of course, it is very much subjective and practically individualized approach. However, there are core ingredients of metabolic optimization therapy. Latest research data shows that mitochondrial dysfunction is the key player in development of the metabolic syndrome. The hallmarks of the metabolic syndrome are obesity, high cholesterol and triglycerides, insulin resistance, hyperglycemia, and hypertension. In addition to that, the reactive oxygen species, the ROS generation, is increased during metabolic syndrome that initiates the vicious cycle, activating an inflammatory response and exacerbating bioenergetic dysfunction of the cells. Ultimately, that all contributes to diabetes, cardiovascular disease, and hepatic steatosis. One of the ways or the products from our research and development division, which is called MF Plus, created specifically for correction of these pathological changes, which help with the help of the naturally occurring organospecific peptides, which is called mitoorganelles, with a code name LPPSM. It's actually is the abbreviation because this specific combination of natural occurring peptides contains a mixture of tissue-specific cell extracts from liver, pancreas, kidney, placenta, and gastric mucosal tissues. Along with this, we widely use supplementation with resveratrol, alpha-lipoic acid, coenzyme Q10, omega-3 fatty acids, and placental growth factors and nutrients. Now, sounds pretty much like a lot. So to overcome the problem of prescribing too many capsules and tablets to a single person, we use the specific range of supplements, which are called MF3 evolution range, in which all of these essential molecules are put together in a single soft gel. Additionally, in cases of type 2 diabetes and obesity, we widely use the 7-keto DHEA, which does not convert into estrogen, neither testosterone. However, it increases the thermogenesis and prevents the decline of metabolism in a dieting person and in the case of caloric restriction. Apart from that, which is very important, 7-keto also increases sensitivity to insulin. By the way, as an example of one of the successful outcomes of such programmatic approach is one of our patients with the initial HbA1c reading at 11%. We were able to bring down HbA1c to 6, and the latest blood work shows 5.8. The third pillar of longevity and wellness is hormonal optimization. This topic actually requires a separate lecture on its own, but I'll try to be as much concise as it is possible. The regular physiological menopausal changes in females can be effectively dealt with hormonal replacement therapy, which has few options, including synthetic hormones and bioidentical hormone replacement therapy. Now, cases of the early stages of premature menopause, and the premature menopause is a pathological condition when specific etiological factors are ruled out and excluded, can be managed with a biohormonal revitalization protocol with the mitoorganelles female fertility peptides. Provided that all possible factors causing the premature menopause are excluded and therapy is started immediately without delay before the menopause is fully manifested, the early hormonal changes can be possibly reversed via the activation of the hypothalamus pituitary gonadal axis. The situation is quite different in males, in men. Men have the early physiological decline of testosterone production that starts at the age of 30. This situation is further complicated by the so-called generational decline of basal testosterone production in the global male population that is occurring for the past few decades. Such generational decline is caused by introduction of processed foods and foods with pro-estrogenic activity, stress, chronic stress and overstress, increased prevalence of metabolic disorders, obesity, sedentary lifestyle, and plenty of other environmental factors. In some cases, when condition is diagnosed in the very early stage and when patient is relatively young, it is possible to reverse hypogonadism via the reactivation and stimulation of the hypothalamus pituitary gonadal axis. The treatment protocol for that includes human chorionic gonadotropin plus selective estrogen receptor modulators, it's either clomid or tamoxifen, plus organospecific peptides of the hypothalamus pituitary adrenal gonadal axis. But in this case, we have the special formulation, which is called mitoorganelles, with the code name male fertility. Speaking about the reactivation of the hypothalamus pituitary gonadal axis with the organospecific peptides, the peptide formulation that aids to the human chorionic gonadotropin is mitoorganelles male fertility. It is a 5-in-1 combination of peptides containing naturally occurring organ-specific peptides cell extracts from the following tissues. It's hypothalamus, pituitary gland, adrenal cortex, testicular tissue, and liver. In case of hormonal imbalance and fertility issues, there are at least two aspects of the problem, which are called primary and secondary. It is either failure of the central mechanism of hormonal production, which is hypothalamus and pituitary gland in the brain, or failure of the peripheral organs, the gonads and adrenals. In reality, in most of the cases, we have to deal with both of these problems. Hence, the treatment strategies require simultaneous stimulation of both the central mechanism, hypothalamic releasing hormones and pituitary stimulatory hormones, as well as stimulation of simultaneous adrenal stimulation and gonadal stimulation. To facilitate endogenous hormonal production, it is also essential to add zinc, vitamin D, which I've already spoken about, and human growth hormone, because these are required for testosterone synthesis and the production of good quality sperm in the testicular cells. And the minimum duration of this protocol is about 4 months. And after the successful completion of the protocol, it does not require a continuous maintenance phase. It does not require that. As an outcome of biohormonal optimization therapy in men, we can observe increase in maintenance of the steady serum testosterone level for at least 1 year of the follow-up. In some cases, it's even longer. The success rate of this protocol is gradually reduced in individuals older than 60 years of age, which is quite understandable. And those cases can be managed with testosterone replacement therapy, which has many options and is capable of providing any desired steady testosterone level easily, as long as there are no absolute contraindications for TRT. Anyways, the biohormonal optimization therapy and stimulation of the hypothalamus pituitary gonadal axis should be considered as a gateway to TRT in quite a number of cases. As a complement to hormonal optimization, a number of local-based treatments are used as well, such as the low-intensity shock wave therapy and the vacuum suction. And these modalities can be used every 2, 3, 4 weeks. Apart from that, for men with erectile dysfunction, we also recommend and provide the intracavernospinal injections of cell therapy, which usually is done according to indications once in about 3 to 4 months. And we use for that the nanopeptides, so-called the nano-organopeptides, cell extracts from placenta and testes. And you can see the specific points and the technique, how it's done. All these modalities are very well tolerated by patients. They are usually done outpatient. They don't require hospitalization. Some can even be performed by the patient at home, like the vacuum suction, for instance. And that's all the updates that I had for you. For more information, ladies and gentlemen, regarding the products and services of European Wellness Group and our partners, please visit the websites of the European Wellness and MF Plus. And for those who are interested in educational seminars and webinars, check out the website of the European Wellness Academy, where you can watch weekly webinars free of charge, participate in real-time Q&A, and have a direct access to the speakers and educators of our academy. And one more great news, please check out on the latest startup of the European Wellness Group, the BioPep, which is the R&D company, USA-based, and its focus is primarily in peptides and research in the field of organospecific peptides, its potential areas of application in humans and animals, including pets. So if you have questions, you can always follow me and contact me via social media, Instagram, where I always answer to all questions and comments. And you can get plenty of updates and information there on my page. Thank you, RAADfest, for your wonderful attention. Stay healthy, be alive, and have fun. It was Dr. Dmytro Klokol with you. See you guys. Cheers.